So hi, I'm Ed Kobiak, and this is MJ. We're going to be doing a diagnosis and treatment of the shoulder injury. So far we don't know exactly what's going on with it, but through the course of the diagnosis we're going to zero in on what's probably going on and then do some treatment for that. So can you tell me a little bit about what's been happening?
Yeah, it started out in the joint up here, just soreness, which I've had before, and then it's
How long ago?
on and off for a few years.
Okay.
I'm swinging into a falls in Hawaii. About 2 months ago, I fell down the stairs in my attic, and I was holding onto the wall as I slid down this way, which I can feel. It hurts in there. This direction, and slid all the way down the stairs. Shoulder, like I can feel it when I'm lifting, inward rotation. It really gets sore in here.
It's really when it's either behind you that way,
behind me or internally rotated.
And is it getting worse? Or?
Yes. And I just moved, so I carried lots of boxes.
So it's aggravated.
It's aggravated. And it hurts at night
when you lay on it?
I can lay on it a certain way and it's fine. But then if I lay on my left side and it feels like the joint is pulling down, that weight of my arm. Yes. And I walk dogs a lot. I walk at the animal shelter, so I have to walk on my left hand because of the pulling of the dogs.
Okay, so it has a pretty big impact on what you're able to do. And keep it there. I'm going to press it down towards your leg.
Yeah, that hurts.
That hurts. Where does it hurt?
In here.
Again, we're combining a couple different kinds of treatment. For this kind of clearly structural injury kind of condition, I find it really helpful to do this motor point needling that Matt Callison developed. I also like to include the treatment of the channels. So, for example, the local needling helps to kind of disperse the qi and blood from the immediate area, but then you don't want to just free it up from where it is and let it just sit there. You want to free it up and then guide it away from there. So usually I will do distal needling along the affected channel so that the qi that's released and the blood that's released will have a kind of a pathway to drain away from the area. Because really in this kind of case, most of the pain that she's experiencing is probably from excess rather than deficiency, and from stagnation also, because when the muscles clench to try to stabilize the joint, you just get it kind of causes an obstruction, but also just concentrates a lot of energy in one place, which is kind of the definition of stagnation. So the idea is to loosen it up in the local area and then guide it away from there. First thing I'm going to do is needle into the subscapularis. And what I'm going to do first with that is locate precisely where I'm going to needle. So the easiest way for me to do that is to feel the muscle and actually move her arm around so that I can feel the tissue moving underneath. Is that sensitive right in there? And then I can find the most sensitive area. And when I hit the spot that I'm looking for here, you should feel a big twitch in the muscle. Kind of an interesting feeling. Alrighty. Because what I'm trying to do here is re-establish coordination among all the different muscles and kind of reintegrate this area. So when I do this kind of treatment, I tend to do quite a few needles because I want to wake up all the individual muscles. The main swelling and indirect inflammation along the large intestine channel. So while those ones are doing what they're doing, I'm going to come down here and knead the large intestine floor. Something there. Does that go down your finger? Basically what I'm doing is a couple things with the large intestine channel to actually work, get chi circulating and blood circulating along the channel, and also some things to start helping the muscle groups to coordinate with each other. Small intestine 9 right here. This isn't actually a motor point or a muscle point, it's more of a channel point. But you should feel from here some radiation of sensation through your shoulder. Do you feel it? So these points are mostly along, they're in the muscle, but they're mostly along the small intestine channel. And so while those are sitting in there, I'm going to do one needle into small intestine 3, which you won't be able to see from the other side. So welcome back. We're here to do a kind of a follow-up visit with MJ. Welcome back, MJ. And we want to talk a little bit about, so far we're about a month out from our initial interview. We did 5 or 6 treatments over the course of about a month. And we just wanted to come in and follow up with how are things different now, what were the results of the treatment, and in order to do that, we're going to go through specifically and watch with MJ some of the initial interview.
I'm back to lifting again, and it feels a lot stronger. It's still a little bit sore, but it feels a lot more connected in there and stabilized.
So you're not having that issue of feeling sagging?
No, I don't feel like my arm's going to fall off my shoulder anymore, and I feel safe to carry things, fairly heavy things I can carry now without hurting it or straining it.
Okay. And how about the inward rotation?
It's better. Like I couldn't do this at all before. You have to still be careful of how I lay on it, but I can lay on it and not be woken up by my shoulder. It doesn't hurt me when I roll over to the other side. Okay. Dog walking is much better, and I've upped my dog walking. And I can use this arm again without it feeling strained.
So I'll go down this way.
It's definitely stronger. The strength is there, but the pain is still there, but it's about half. Or less than half.
Okay.
Yeah. I'm able to do things I couldn't do for a long time, for like 3 months, and now I'm doing them again.
Wow. All right. Well, thank you for coming back in and telling us your story.
Appreciate it.
And thank you, and we'll see you next time.